Good morning, everyone, and welcome to the morning show right here on Main Street TV, where we are blessed to have Kevin Aston with us this morning, who is what is your official title?
It's Health Commissioner.
Health Commissioner here in Jackson County.
Sounds very official, doesn't it?
It does.
Yeah, it's pretty fancy. That's an old term from Ohio law that dates back almost a century, and that's how far back it goes. Like the early 1920s is when the law was written to form health departments in Ohio. And back then, at that point, there was some corruption happening with some of the county commissioners around Ohio. And so when they formed health departments, they formed them so that they were independent of the county commissioners to a degree, so that there's a board of health governing it instead of county commissioners governing it. And then they formed this term called health commissioner, so that in terms of health and safety, that official has the same sort of role as a county commissioner would.
Interesting. So you got the power, man.
Just a little bit. Like, it's really, it's not all that much. It's a glorified administrator job. It's working with people a lot, really, is what that's all about.
I can only imagine what you have to do on the daily, and it's a lot.
Solve other people's problems.
Yes,
is what my job's about.
And keep us all safe.
Doing my best.
And healthy.
Trying.
Yeah. Well, I'll tell you what, we are going to find out what all is going on at the Jackson County Health Department. And, well, we'll talk about this, that, and the other with, of course, our Health Commissioner, Kevin Aston. But first we have a message, and then we'll be back and talk all of the things health-related. How's that?
Sounds good.
Okay.
At Vinton County National Bank, we believe in supporting the areas where we live and work. Now, we'd like to honor those who also serve our communities. Our new Community Champions account is especially for first responders, veterans, active military, and anyone employed in the fields of healthcare or education. This account offers rewards, discounts, and other benefits to those who give so much to others. Vinton County National Bank, rewarding those who serve.
All right, well, welcome back, and we are here again with Health Commissioner Kevin Aston here from Jackson County, and we're going to be talking about some of the things going on at the health department. So you all actually moved. Mm-hmm. I bet that was no easy feat.
No, it's like if you can imagine moving homes and what a hassle that is, where you basically have to uproot everything, put it in a box, make multiple trips in between places,
Sure.
Try to unload it and keep things straight. Now do that times 20 employees.
Right. Like, you're not just moving yourself, you're moving like this building. And let's just be honest, the health department had been in that building since it was built. Mm-hmm. When?
1975 is when that building was finished.
So 50 years ago.
Yeah, right. So I hope this new building that we're in lasts that long as well.
Right,
and I think it will. It's been serving us really well so far. A little bit larger of a clinic area, a little room to grow, more parking. I think just across the street from the hospital. So I think it's a really great location right off the highway there. Great access to it. We're all pleased with it. We feel like it's the space that we can best serve our community in. So it's worked out really well. It's sort of like when you buy a new home and you start discovering some of those idiosyncrasies about the new property. Uh-huh. So there's been sort of that over the last year. We moved in last June, June 24 of 2024. So we've been there over a year now, but still discovering some of those little quirks of the building.
But you can work all that out.
Yeah.
I mean, that just makes it interesting, right?
It's like home ownership, there's always something to do or something to plan for.
Yeah.
It's that kind of thing.
Gotcha.
Yeah.
Yeah, I can't even imagine, like, you buy a new house and you move yourselves, or you move yourselves and your two kids, and then the dog, whatever. But moving 20 people and offices and a clinic and all, oh my gosh, I don't know how you logistically did it, but you did it. So congratulations.
Well, thank you.
Yeah. And from everybody that works there that I've talked with, really, really likes the move, and, I think is very happy with the new surroundings and all that.
Yes, indeed. Now, you just had our nursing director, Kim Hughes, on your
Yes.
show, what, a month ago or
Yeah,
so, wasn't
probably.
it?
Yes, she is a doll.
She is. She told me what a great time that she had on your show. So I just wanted to pass that along.
Oh,
of
thank
what a pleasure it
you.
is to be a guest on this program. But she is a nurse practitioner as well as sort of our leader of our nursing division.
Yeah.
And I'd love to brag about her for a little while if I can.
I would love that. Yes, please.
As you said, she's got a wonderful demeanor. Her bedside manner is spectacular. We are seeing patients, so especially if you don't have a regular healthcare provider, you're welcome to give us a call and make an appointment with her. We do bill insurances. We also have a sliding fee scale for those without
Yes.
insurance. So
That's very important to
It is
know.
very important, and especially for essential services like immunizations. If you really need something, we'll just go ahead and provide that service to you, regardless of your ability to pay. Certainly for things that are really important, like an immunization or service like that. So it doesn't
Sure.
hurt to give us a call and trying to make an appointment with Kim. We're going to be out and about the county all through the month of October. We were going to wait and start giving flu and COVID shots in October, but we've had so many call-ins about them that we've already
Yeah.
started. And
I think people are just really. I think last year's flu season was pretty gnarly, and I think people are a little panicked about it.
certainly the ones that are calling in wondering when they can start. So we thought maybe
That's great.
we would start flu shots in October because the flu season lasts. Like we've had in the past in Jackson County peaks of flu activity in March and April
Yeah,
even. So
right.
we don't want to give the shot too early so that the immunization wanes by the time that there's really a lot of flu activity here locally. So that was the thought process. But as I was alluding to, the demand has been high. So we just went ahead and started. So especially for those of you that are over the age of 65, Medicare will cover both flu and COVID shots. They are two different shots, but you can get them like one in each shoulder on the same visit.
Yeah, at the same time.
And so
Two birds with one stone.
Yep, recommended, especially for those over 65. For the flu, we have the high dose for that age group, if that's what they want.
Okay.
Let's see. Yeah,
So let me ask you, God, and God bless you for getting us all through this pandemic situation. Because and being in the restaurant business, it was concerning too. You're responsible for the health of the public and keeping them safe. And this poor man, I would text him or call him and be like, I don't know what to do with this situation, or what do you think? And so, you had, I'm sure, a million of those calls every day during this COVID thing. And COVID is still out there. So what are the recommendations now as far as the COVID vaccines and all of that while we're talking about it?
sure, and that's certainly been something that's been a lot in the news. A lot of like federal level changes being made to the federal public health.
And it's hard to keep track of all this stuff.
It is. Even from my point of view, it is because, as I said, the things at the federal level are in flux. And I have to say, maybe some politicians getting involved with public health decision making at that level. So if politics are at play, then of course things are going to evolve and change.
Yeah, Adrian, it's funny that you brought that up. Adrian and I just had a big conversation right before we went on the air about these politicians. But that's neither here nor there because we
Well,
don't want to talk about that. But yeah, no.
I am
From
not a
your
politician.
standpoint,
No,
I get it. It would affect you.
I think public health needs to rise above politics.
Please, yes.
And public health is a subject that we need to be talking about. So once again, thank you for having me on your show to do just that.
Absolutely.
But yeah.
So COVID.
I want us to remember as we're talking about COVID, as we're talking about any of these issues, that we all have more in common than we have in difference.
Yes.
That's what I like to try to remember as
like
we're dealing with some of
lot
these.
more in common.
I think
Yes.
so. We all want to feel safe. We all, want to be healthy. We all want to find our purpose in life. We want to be able to take care of our families. Those are
Right.
things that we all have in common. We all need to remember about each other. And I think that your local public health department is trying to help with those things where we have opportunities to do that. So to the COVID shot then, currently, to my best understanding, it is not available for children under the age of 4 years.
Okay.
So that is different than back during the pandemic when that was first rolled out, children over 6 months of age could have got it
Sure.
at this point. But as it stands at the moment, that age group is not approved to get
I
it.
wonder why. Politics. Okay, I'll say it. You don't have to.
I like to try to make decisions based on the best available evidence that is available, and
Sure.
that I can get a hold of, and I think that that's the way that I'm going to continue to make decisions, is based on the best available scientific evidence. And I think if there are questions about whether or not someone should get the COVID shot, they should talk to their regular healthcare provider about that. That's
Yeah.
the kind of person, like your regular doctor or nurse practitioner, that advises you on all aspects of your health,
Yeah,
not just the
and-
controversial ones like a COVID shot.
You're right. And if you're not trusting in that person, then you need to find a new healthcare advisor. You know what I mean?
Absolutely.
Or yeah, because that is the person that you should be talking about, with these things about. But so are they still recommending like the COVID shots like yearly for everybody other than, 4 years and under, or I mean, or is it just people that might have like some compromised immune problems, or
It is a little confusing right now.
Okay.
But the best I can make out is it's sort of a yes question mark. Like, definitely for the over 65 crowd, it's recommended from the federal health authorities. But for folks between 4 years and 65, if you have some sort of underlying health condition, which there's a whole long list of these, like, don't even ask me to try to spout them off,
yeah,
because obesity is on there, diabetes is on there,
Okay.
lots of chronic conditions are on there. And then, the sort of the recommendation is at this point that if you have an underlying condition and you want to get it, then you can get it. Whether or not your insurance will pay for that is another question mark.
Okay.
And so that, the payer sort of question is sort of related to the recommendations. And like I said, because those are changing and they're sort of in flux right now, I would expect which insurers will pay for COVID to also change as time goes on.
Sure.
So
It's all still fluid then.
It's gray. I'm afraid that's the sort of the answer, the best gray answer I can give.
Well, that's the whole point of this whole stupid pandemic thing, was everything was gray. I mean, and it just was, and
Well,
it still is.
I said this a number of times during the pandemic, and I'm saying it again today, that if you have questions about COVID or COVID immunization or anything really, don't hesitate to bring those up with your regular doctor,
Sure.
your primary care provider, whoever that is, the person that you trust to advise you on your health. The other 364 days of the year, they're there for you today and any other day you've got a question about COVID shots or anything else.
Sure.
So
It's an individual decision, I think,
It
and
is.
and as is the flu shot.
It is.
I mean, so we have very little control over our lives. At least you can control that, I guess.
for sure.
So, but those are available at the health department. If you are looking for that, you can stop out by or make an appointment.
It's best to make an appointment. Yes, I was starting to say a moment ago that we've got a busy October planned. I looked at the calendar where our nurses are going to be, and almost every day of the month they're going to be out doing a clinic, giving shots somewhere in the community of
Okay.
Jackson County, whether it's at a nursing home or an apartment complex or a business or a school. Like, we're going everywhere that they'll have us to try to immunize and protect people. So it's best to make an appointment. That's the most likely way that you'll be able to come in at a time that works for you, and that we can then
Sure.
guarantee that we'll have a provider there to immunize you at that point.
Yeah, because Kevin's not going to do it.
I'm not the actually giving the shots guy. I am
don't
the
want
running
him-
the spreadsheets to make sure we can afford to buy the shots to give them to
Right.
you guy.
He's the hostess with the mostest, or whatever. That is awesome. So immunizations, and like anything that you can think of. I know, like shingles shots or tetanus shots, like some of those things that we need to keep up on as well. Yeah, I just turned the big 50. Am I supposed to?
Congratulations.
Thanks.
It's just a number. It's just a number,
Thanks,
isn't
friend.
it?
So I was like, talking to my husband, though, I'm like, I think that we're supposed to go get the shingles shot now because we're old. And he was like, oh, gosh.
Well, call in with that question, and somebody that is an authority on that, that knows the shot schedule really well, will answer your question
tell
about
us.
it.
Yeah, absolutely. So, and again, those are all things to check out with your healthcare provider or the health department. Of course, you could always call Kim and talk with her as well. So, okay. So immunizations are certainly a thing. And I don't know why we have a health department and people don't think to utilize it. And this is what I was talking to her the other day about too, is it's like, you do have all of those. You actually, she can see people if you're feeling bad or whatever, that's the health department's there for you. Why do people not think about that?
I think when things are going well, we're doing our jobs, or things are relatively calm. It's one of those sort of, okay, things are okay, everything's good, we must be doing okay, and so it kind of slips into the background.
Yeah, maybe,
it's only when there's like some sort of emergency or a pandemic
or a global pandemic
or something that everybody starts to, oh yeah, they're around, and we're glad that they're around, and they're in the spotlight all of a sudden. But yeah, no, we're not used to so much being in the spotlight or necessarily trying to grab headlines or
nor
tout
do you
ourselves
want to be.
too much.
Yeah, and you're exactly right. You don't want to be in the spotlight because that means that you're having a global pandemic or something, crazy that's going on. So we like to keep you guys on the back burner a little bit.
Well, yeah.
But knowing that you're there if we need you.
That's right. One of the exciting parts of my job, and I think of all the folks that work at
Spreadsheets?
that would be number two.
Okay.
But I, you get into this sort of work, not for the spreadsheets, although I do love me a spreadsheet. I am.
Oh, you're one of those.
Yeah, one of those guys, one of those nerds. But the main reason, so I can do spreadsheets anywhere though.
Sure.
But what I can't get anywhere that I do get working at the local public health department is all those warm, fuzzy interactions dealing with people in the community.
Yeah.
And so one of the fun things about my job, it's very dynamic. I never know who is going to be on the other end of the phone line when the phone rings. Like it could be any of you saying anything, questioning any question that's on your mind, or just calling up to chat about whatever's on your mind that you have that's a health related topic to talk about. So it makes it interesting.
What are some of the strangest calls you've gotten? I know there have to be some.
Oh my! I have to think of some that I can
That are
talk about
appropriate.
that are appropriate and then are like de-identified, so I don't reveal anybody's identity. Oh, let's see. Oh well. So a lot of times when there's a problem on a property, we'll get someone call and complain about it. And, they want us to go out and investigate to see if whatever's going on their neighbor's property is a health nuisance or not. So something that actually could affect human health, that's where our authority then, extends to those sorts of issues. But I have to tell you, a lot of times, almost every time, there's a backstory.
There's an underlying issue there.
There is an interpersonal issue.
So it's a spite thing.
A lot of times there is some background drama before it ever rises to the level of someone bringing it to our attention. So then we'll say to these folks, like, okay, if you feel really concerned about it, if you really think that this is a concern for your health or someone else's health, would you be willing to fill out a form and sign that you're making a formal complaint? And so many times people are like, oh, whoa, no.
No, I want you to do it for me.
Yes. We want you to be the bad guy. That's why we called you. Okay. But if it's a legitimate concern that you have, you're not concerned enough to put it down in writing. Oh, whoa. And so depending on what they say, sometimes we'll still go out and I'll be the one to sign, the form. But yeah, I say all that to say that if we're here to serve, but don't just try to sick us on your neighbors that you may
that you just
have
don't like.
an underlying background, issue with. So
I can see that happening all the time too.
it doesn't happen all the time, but like I said, you never know who's going to be on the other end of the line when the phone rings. So it's fun, and it really keeps life interesting. I feel very fortunate to be able to serve Jackson County at the Jackson County Health Department, and I know my coworkers and I do too, because like I said, we try to bring the sort of values that I espoused earlier about wanting to promote people's health and wellness, wanting to feel like we're helping anyone, and that everyone is deserving of that help. Once again, we're all alike. We all have the same basic needs, and we're all in this together.
And I'm glad you said that, because other than the politicians and the Facebook stirring up all of this, the arguments and the stupid things, and we all are so much alike at the end of the day. And I just don't know why people focus on the 5% of what we disagree on.
Absolutely.
It's really annoying.
And
that's just my soapbox for a moment.
You and I could disagree about something, Jennifer, but I would hope that you and I would stop at a certain level. Like we're not going to take the disagreement too far. We're not going to get so upset that we can't even talk to each other anymore, or heaven forbid one of us starts thinking about getting violent. Like no. We're going to stop, because we realize that what's really important is we got to share this planet together.
Yeah, I agree. If you just think of it it's a simple way to think of it, but I think it's a good way to think of it, right? Mm-hmm. So what are when it comes to the health department, what are the things that you're facing right now that people, are really needing you for? Mm-hmm. We had a pandemic. Mm-hmm. It's still out there. Mm-hmm. COVID is still out there, but obviously not to the degree that we were dealing with it before. Mm-hmm. And but so what are some of the other things that you all are dealing with at this moment?
I think that the main thing, and this has been an issue since I came here to Jackson to serve Jackson County 12 years ago now it's been.
Has it really?
Yes, it has been. And the time has really flown. But the word on everybody's lips when I would go around and ask them, what do you think is the most significant health problem in our community? Or we would even do surveys to this end, and on surveys ask folks, well, what do you think is the worst, most concerning health issue? And what do you think that they said?
Well, I have. Oh, gosh.
Think about over the last decade. If there's one sort of through line as a health issue that's on that's concerning people.
Does it have anything to do with what you were talking about on the radio?
I'm not sure. What was I talking about on the radio?
Well, we'll get to that in a minute.
I don't. If
you were talking about butts, I heard that.
We'll
talk about that too.
Well, okay.
Yeah.
All right.
But no, health in our area. I don't know. I would say like smoking.
Okay, smoking. Yeah, I would put addiction as that sort of issue, of which tobacco addiction is one of the strongest addictions. But yeah, a lot of people were saying like, oh, it's the drug overdoses and the drug problem, and so that still is an issue. And I think that a lot of things have changed in the last decade with that. There's been a big settlement you might have heard about with the drug manufacturing companies, and money has gone to the state and also to the local levels to try to combat that issue. I think the public's sort of mindset about that is evolving. I think I have seen evidence that compassion for those that suffer from substance use disorder is increasing on a lot of different counts. And I think the health department has sort of evolved in its mission and its sort of scope of services to try to impact overdose deaths and drug addiction where and how we can. We do see folks that have those sorts of issues in our clinic. We give Vivitrol, which is like a shot that will prevent you from actually feeling high if you try to take opiates. It's a way to sort of help people in recovery stay off them. As a supportive service that way.
I was actually talking with somebody, actually a friend of mine that's in recovery right now, and he was telling me that he was on that, and
great.
That it's just because I was like, I don't know what that is, and he was explaining it to me, and it just seems like that makes sense. Because then you just, no matter what you do, you're not feeling that that sensation, I guess.
So sidebar about recovery. So there's sort of like three legs of the recovery stool, and one of them is counseling. So that's not a service that the health department offers. That'd be more like the mental health side of services. So having a counselor that can help you work through, your recovery that way. A second leg of the stool would be social support from friends, family, that you have a supportive environment socially and not a negative environment socially that might steer you back towards to using. And then the third leg is like a medication support to your recovery, and that's where the Vivitrol comes in, and that's the sort of part where we actually can help with that. Like we'll help Warriors for Christ, for instance, with Vivitrol, and then they get their social support and then their counseling out there, and then we can help with that third leg of the stool, for instance. So
love that.
So that's one thing that we can do. I'll give you another anecdote about how we're trying to prevent the harm and the death that can be from addiction.
Sure.
We gave out over 200 Narcan kits during the Apple Festival, which was it was like flying off our counter. Like none of us could really believe how many people wanted to start carrying Narcan.
And it's one of those things that before I feel like it was so taboo.
Exactly.
Like, why would I have that? I'm not a drug addict. Like, why would I have it? Well, I feel like everybody should have that because you just never know who you're going to encounter. And we talked about it here with some of your folks of, Narcan can be used for maybe an elderly person takes too much of their medication, they get confused, or there's any number, or a child, God forbid, would get a hold of something. Like there's all of these things that that you could use that for, not just I'm out and about somewhere and someone ODs, which you obviously use it for that too. Can that be used on animals?
It theoretically could be used on animals. I'm
I
not
wonder
sure
about that because I could see like a dog or something getting
into your pills, and then you want to give it
a
use it for that. Sure. I don't know if it's been tested on animals. Honestly, I don't know. I'd have to go research that.
I don't know why that just popped into my head.
But
I told you I was going to think of weird things.
If you think that your dog got a hold, like if you didn't screw the cap on your bottle of pain pills well enough and it fell off and your dog ate them all. Narcan might be your only recourse there, so you're going to want it for that reason, if for no other reason. I think that Narcan is one of those things that like you want to have it just in case you need it. Like you said, you're not sure, you might happen across a situation that you didn't plan for, and someone's overdosing and potentially going to stop breathing and die. And don't you want the tool in that moment to help them, to be able to save them?
Yeah.
In that moment, in that emergency, there should be no judgment about who is this person? Are they worth saving? No.
Agreed.
All human lives are inherently valuable. We want to give that person a chance to live, and hopefully they'll get into recovery after that.
Yeah.
Which that happens. Sometimes people have to relapse a number of times, just like with cigarettes. A lot of time people will try to quit, and they can't quit. Now, does that make them a bad person or their life meaningless? No. We want to give them however many chances, because, like I said, no judgment in those sort of emergency situations.
We all have our vices. Let's just be honest. Some of them probably more severe than others, or harmful than others. Some people eat ice cream every night, and their doctors don't like that. That's bad for you to eat all the ice cream in the world. But you know what I mean. We all have our vices.
Is one of yours, Jennifer, being on TV?
It might be. I don't know.
Anyway, proceed.
But no, we all have different things that we do, and
we're all human. We're all flawed. Little
addictions, if you will, or whatever. Some just more, as we said, detrimental to you than others, and so if I was just thinking, I mentioned my friend earlier, and he is in like full blown, a recovery place where he lives there, and we're going through the whole situation, and talking with him about it, I was like, well, I'm going to be riding your rear end, right? Like, I am going to have my eyes on you, and I am going to make sure that I don't see anything, because that's what a friend does, right?
Because you care about him. And
Yes.
you want him to be successful in his recovery.
Yep, very much. So there is that. But if somebody is, maybe they're saying, I'm listening to this show today and I am hitting rock bottom, or I just, I'm really worried about this family member or whatever. Can they start with the health department? Can you all get people in the right direction? Because I think a lot of times people don't know where to begin.
Absolutely. We can steer you in the right direction.
Okay.
Yeah, we do not have like a clinical psychologist that can do that counseling for you, but yeah, we know how to refer you to those.
That's important.
We certainly do that. Yeah, part of our job is to help people connect to other services that they can take advantage of. So absolutely, don't hesitate to ask. I'll just plug our phone number while we're talking about asking
please.
us. It's 286-5094. And again, that's one of those off the wall or unusual sort of requests. That might be an example of one of those. So we're used to answering those sorts of questions. So do call us if you're wondering.
Look at them as kind of, and I've said this before, I think when Marcia was here and some of the other folks, like you all just think of them as kind of the concierge of your health needs. So if you don't know where to start, call the health department and they can get you headed in the right direction.
Marcia Radeball is a great example of this.
She is awesome.
She's a licensed community health worker, and that's what a community health worker does.
Mm-hmm.
They're an advocate for your health. They help you navigate through the health system. They know what resources are out there and how to connect you with those. So yeah, that was her full-time job for a long time now. We've given her some other duties as well now, but
Yep.
she still does do that. And
Yep.
we have other employees that just do that kind of thing as well. So
It's awesome.
Yeah.
Absolutely. So you're not alone out there struggling or floundering around treading water. Like, call the health department. That's why they're there. So, all right. Well, let's get into the STD thing for a minute, because that's what you were talking about on the radio that I heard.
oh,
Yes.
okay.
But it is a thing.
It is a thing. So the billboards with syphilis is I think how that started.
How they brought it. That's how they brought it up.
Yeah.
And but I will say, I want to make sure that there are things that we can talk about openly here on this show. If we can help one person, then we should. And I think they're called
STI, like
STIs
sexually
now.
transmitted infection.
Infection rather than disease. I don't know. Whatever.
Yeah, whatever.
It's a thing, and they're on the rise.
Mm-hmm.
And let's talk about it here.
Chlamydia is the most commonly reported infectious disease of any kind in Jackson County, year in and year out. Barring like a COVID pandemic, it's the most common thing that we're notified
Really?
of. Yes, and you know what?
Thank God I don't know what these things are. I've heard of them, but I don't know what they are or what they do.
Spread through sexual intercourse.
Mm-hmm.
It's not skin to skin, but it's that sort of soft tissue of your body coming into somebody else's soft tissue in their body, and that's how those sorts of sexually transmitted infections spread. So
Okay.
I say that to say, just like syphilis, though, chlamydia, while syphilis is not particularly common in Jackson County, that's not to say that there aren't cases. There are. But it's spread the same way as chlamydia. It's spread the same way as HIV. It's spread the same way as HPV and a number of other sexually transmitted infections.
Sure.
So wear a condom. Use other safe sex practices. Just be aware that is a thing here. A lot of times it's the folks that think that, well, it's never going to happen to me. I'm too young to worry about that, or too old to worry about that. There's sort of a section of the cases that are folks that are, maybe they had a spouse die a little later in life and they're back out there now meeting people and
they're
mixing.
swinging out
and
there.
they've not had to think about that for decades.
That's
And
fair.
it happens. It happens. I can vouch for it happens. So once again, just be careful. Realize that's one of the risks of having sexual intercourse, and it's a risk that can be reduced, and it's something that we all just need to bear in mind if we find ourselves in those sorts of situations. That you think it may never happen to you, but I'm sure just about everybody that it happened to thought it's never going to happen to me. That's why I didn't wear a condom. So wear a condom.
I'll bet you have those at the health department too.
We do.
Good Go out today and say, I want some of those condoms that Kevin was talking about on the show.
We can give
See
you
what
some.
happens.
But they're also not hard to find. Like you can buy
No.
those in just about any store, any gas
Listen,
station.
if you're
even.
embarrassed to go, it's called Amazon. Just, order them if you're embarrassed to go get them. Because I feel like that's a thing.
And for any of the younger set, if you're too embarrassed to go buy condoms, then maybe you're not really ready for sexual activity. If you feel
That's a good point.
maybe you need to wait if you don't feel like you can do it safely as an adult. So
I love that. That is a really good point that you just made. Yeah. Grow up.
If you do wind up with a sexually transmitted infection,
yeah,
a lot of times we can treat those.
Okay, that was
depending on
going
what
to be
it
my
is.
next question,
Yeah,
yes.
so we do have a clinic that will see folks, and a lot of times folks will maybe they'll be embarrassed, and again, you shouldn't be. This is an adult topic, and maybe there is unfortunately still some shame associated with it, but there shouldn't be. This is a health matter. Like anything else,
Same as a cold or anything else. Like
try to be as mature as you can when handling this, and if you have questions or concerns, your regular primary care provider should be able to help you out with those. If still you feel like you don't have a regular PCP, or you don't want to talk to that person about it for whatever reason, then you can come into the health department and you will be seen and treated. And, we want to make sure that you get that treatment and you're not out spreading it around, and, you're not having your own health effects from it too. So
that's the main thing, is that you're not spreading it.
Yeah.
You have to deal with it yourself, but you also need to make sure that nobody else is dealing with it.
It's your responsibility to make sure that your health doesn't negatively impact other people's health. You need to make responsible decisions for yourself, but also take into account how your decisions may affect other people.
Right.
And again, try to be mature and own that sort of responsibility. And I think, we'd all be a little healthier in that case.
Yeah. Well, and I think that goes back to what was being preached during the pandemic, and that was, we're wearing these masks not to protect ourselves, but to protect others.
I suppose it is a similar train of thought there.
Yeah.
Yeah.
So, okay, so one last question about that. So if somebody does come in and they have, HIV is not helped by penicillin, right? So
That's virus. There are medications for it.
There are now that are better than when it first came out. But are there other STDs that are not treatable that are viral? Like,
I think HPV would be a good example of something that we have a vaccine for it, so we can help prevent some of the strains of HPV. Like, there's a lot of different types of HPV, like different versions of it, but there's a vaccine that prevents a good number of them. HPV is human papillomavirus, and it can cause cancer in both men and women.
yes.
So that's one where it's much easier to prevent than it is to treat. So we would encourage anyone under the age of 45, if you haven't been immunized, to call us up and get started with, it's a 3-shot series. Our nurses are so good at giving shots, like you won't even feel the shot in your arm. That's how practiced they are at it. And like I said, get immunized, then you don't have to worry about it so much. You should still be practicing safe sex, but that's a risk that you can reduce. And I think, again, I've been talking about our sort of philosophy at the health department this morning on a number of different issues. That's kind of our philosophy about how we approach things. Like, if there is something proactive that we can do that would help out, we want to try and do that to protect people's health. And so you can help us with that by being immunized for things like HPV that you're eligible to be immunized for. Because, again, it protects your health, but also has an impact on the community. And that's one of those things that you don't have to worry about, your decision affecting somebody else negatively.
Yeah, absolutely. Love that. Well, very good. So that was a fun topic.
You asked.
Hey, listen,
Actually, they asked on the radio.
They asked. And listen, I just feel like we can be mature adults here and talk about this, and because it is a thing and it's a problem. Mm-hmm. So there you go. Okay, what were you saying about so fun fact, I heard you had a big fancy word for a nice butt.
So
This was on the radio too,
was in
and
with Matt.
there's a backstory
Yes,
to it.
I walk in there. They're like, "Hey, before you go on Jennifer's show, do you want to go in with Matt?" I'm like, "Sure, I'm here." They're like, "Yeah, that's how we treat people when we bring them to Total Media. Is like we bring them into all the different shows,
All the different places."
And I'm like, "Well, that's why they call it Total Media." So I go in, and he starts like as soon as I hit the door, he's talking about like, "Okay, we got some fun facts." It's like he starts talking about butts.
About butts.
He starts talking about that, and I'm thinking like, okay, what did I just walk into, and how am I going to contribute to this conversation? So
Right.
after the break, after he said that, I was like, I've got a factoid that maybe your listeners didn't know.
I think this is great.
I was like, what's the medical term for a nice butt? Number one, it's funny that there is a medical term for a nice
so
butt.
That's why. Why is there a medical term for a nice butt?
I bet there is.
And isn't that relative?
Yeah, I've never heard or seen like what the straight up definition for a nice butt is, and it probably changes over the years, like in eras and preferences change.
You got the Kim Kardashian, and then you got the supermodel, and so whatever.
So which is it?
I don't know.
I'm sure that is subjective.
Yes.
I don't know, but the word is calpigious or calpigian, like as an adjective, like. Kim Kardashian is calpigian.
Yes.
That's how you use that in a sentence. I think it's funny. It's funny that there's a medical term.
So use that in a sentence. It's in the comments.
Oh, great.
Use that in the sentence 5 times today, and it will stick in the brain. So thank you, Health Commissioner.
That is my contribution to the community for today.
If you take nothing else out of our conversation, now you know.
That was the only important thing I said.
Yes, exactly.
The only thing.
Oh my goodness. Well, I'll tell you what, Pete Wilson did come in, and he has a stack of news there that we're going to get to. And I want to thank you so much for stopping by today. It's always so fun to talk with you, and a lot of important topics, but we like to have fun and understand too that the health department is a pleasant place for you to go, and that they are there for you all, and that's the point.
Absolutely. You're all welcome to come and visit. We'll give you a walkthrough. This is the facility is something that we're really proud of and that we want to share and serve you out of. So happy to give anybody a tour if you want to come by, or just to talk to us about whatever's on your mind. Could have been any of the subjects from today.
Sure.
Jennifer and I just basically ad-libbed this. We didn't sit down with an agenda in mind, but I want to thank you for being such an easy host to work with, that me or my staff can always come by and just chat and use this as an opportunity to engage with the community a little bit.
You're
you
welcome
just make
anytime.
That so accommodating. So thank you, Jennifer.
Thank you so much. And of course, Health Commissioner Kevin Aston here in Jackson County, we want to thank you for spending your morning with us. And again, come back anytime, because there's so many topics we could focus on, but we touched on a little bit of a few today. So
sure, will do. Thank you.
All righty. Well, I'll tell you what, Pete Wilson is waiting in the wings, so we have a couple of messages here. So says Adrian, and then we'll be back with Pete Wilson and some news.
From breaking news to heartwarming stories, the Telegram is your ticket to the latest buzz in town.
Read your daily dose of local headlines, sports, and entertainment and more, in hand and on paper.
Get a print and digital subscription for only $7.95 per month. Delivered fresh every Wednesday and Saturday.
Visit thetelegramnews.com or call 740-286-3023 today.
Don't just read the news, be a part of it.
Did you know Jackson is home to a locally owned and operated full-service print shop? Zip Printing covers all your print, signage, and design needs. From business cards, booklets, and posters to yard signs, banners, screen-printed t-shirts, oversized signage, and more. We can help you or your business advertise and look good doing it. Zip Printing also offers logo design. Allow us to assist you in building or elevating your brand today. Zip Printing is located in the Stockmeister Plaza at 708 East Main Street in Jackson, Ohio. So stop in or give us a call at 740-286-3023.
All righty, and we are back with our good friend Pete Wilson, who has a stack of news I see there, and a lot of pictures to go along with them.
Well, I'll say this up front. This is going to be pretty bland. I have nothing about butts or anything
in that category. But
What is it? Calpigian?
right,
Calpigian.
you're never too old to learn a new word, right?
Go home and tell your wife that.
No, I don't think so.
What do you think she would say if you said,
She would look it up and.
walking away, baby, looking quite Calpigian today?
Okay, all right. I'll write that down in my palm and
Would
be able
she
to say
would
that.
she bop you on the head? I mean,
probably.
it's a compliment.
Yeah, well, probably, I know, but I don't think so. All right.
You never know. It may get you some brownie points, Pete. Okay.
That's right.
Anywho.
Okay. All right. Well, anyway, we've said a lot and reported a lot about, the Maud Collins mural
Yes.
in Vinton County.
Yes,
There on the west
very
side
cool.
of the courthouse. And there's Maud, of course.
Such a cool story.
Right. Just love that hat. I love that hat. The hats ought to come back for women and men.
They should, yeah.
You saw all those old pictures, and everybody's got a hat on.
Yep.
But Maud, of course, the first female sheriff in the state of Ohio. This is the 100th year anniversary of her ascension to the office of sheriff.
Mm-hmm.
That mural is coming along well. We'll have an updated photo of that later in the week. But we know it's going to be done because they have named a date for a big dedication event.
Ooh.
It is, this is very predictable, Thursday, October the 9th, which is to the day the 100th anniversary of when she took office.
That is so
kind
cool.
It was kind of a bittersweet thing because she was taking the office because her husband was shot and killed in the
Yes.
line of duty, Fletcher Collins, who was sheriff before her. And the dedication ceremony, of course, Amanda Mason, such an amazing young lady, has organized a nice event. It'll be more than just a ceremony. There is going to be a ceremony there on the courthouse steps in the front, I think, is where they're going to do it. A little bit more room to gather
Very
there.
cool.
It's going to be like at 4 o'clock, but, let me check that. It is going to actually be at 6 o'clock. The memorial dedication ceremony at 6, but there's going to be associated events kind of from 4 p.m. to 8 p.m., kind of like a downtown celebration.
Awesome.
That is being organized there by the Vinton County Department of Tourism, a.k.a. Discover Vinton County.
Yep.
And we know that the mural will be done. The early pictures that we saw, it was just blossoming. It will be done. But from 4 to 8 p.m., there's going to be sidewalk vendors, food trucks. There'll be face painting for the kids, balloon animals, and many more activities.
Fun.
Right now, to make it as big as possible and to make it as inclusive as possible, they are inviting vendors to sign up. You need to sign up through the Discover Vinton County office, and it'll just be a big party, to celebrate history and to bring more people downtown. There will also be a reception at the Vinton County Visitor Center at 104 West Main Street after the dedication ceremony. So once again, all that is happening on October the 9th. That is a Thursday. So mark your calendar for that and celebrate something that I think will be a great addition to downtown MacArthur.
Sure.
You roll through there and you see that mural, and people will want to stop and see, well, now who is that lady and why is she on that wall so big? And, the story, it has gained statewide attention. It's written up on the Ohio History Connection website.
It's a cool story. It's a tragic story, but cool.
Right, and the fact that she not only was willing to take the office, this is 1925, a different era for women. 5 years after women got the vote, and there she is in the most so-called manly position you could probably have
For
in county
sure.
government, sheriff. And she not only takes the office, but she is successful with that.
Yes, and
So
she actually got elected.
she actually
she was appointed and then
right.
got
So
elected.
the good folks of Vinton County back in then, they knew better than anybody whether you could handle the job. So another thing on Vinton County, since we just talked about the Maud Collins mural dedication. This is something that kind of flared up on Facebook. A lot of things flare up on Facebook, don't they?
Yes, they do.
Okay, we really stand ready to jump on what is on Facebook. Some of it's right, some of it isn't right, but whatever, it just flares up like a brush fire sometimes.
Yes, it can.
And something happened to the Vinton County Commissioners that they wanted to respond to and they did late Sunday night, so you know that they were concerned about it. But there was a Facebook post that got a lot of attention about issues with the dog pound in Vinton County.
Okay.
And basically, and that Facebook post did get shared with the Telegram, so we knew what the complaints were. But the basic complaint was that an office assistant had been fired, and that, the implication was that shouldn't have happened, that the commissioners have banned volunteers from assisting at the dog pound for liability reasons. Of course, volunteers are needed.
Oh, yes.
And that the commissioners were considering, and this is hot button topic, euthanizing the dogs after 6 months if they were still there. So what happened was there was the commissioners on their statement that they issued on their Facebook page, which we have picked up on and will be putting in the paper and online as well. They responded to this. They felt like they needed to do because they felt like there were things wrong and things taken out of context and misinformation.
Okay.
So I will tell you the skinny of what they said versus those issues, because there were lots of people who jumped on there and they were concerned with what was posted to begin with. And I'm not going to judge on what was posted to begin with. I gave you the basics of what their complaint was that they posted.
Yeah.
They shared with the public via Facebook, and this is how the commissioners responded. They said that the employee in question was not let go because of college hours. This person was let go, so I guess euphemistically, that's a euphemistic word for being fired or losing your job. But the decision was based on the recommendation of the dog warden, they said, and was mutually understood to be on good terms. The reason included late arrivals, work not being completed as required, and scheduling conflicts. The hours that the office assistant wanted to work, according to the commissioners, did not align with when they needed things done.
So it just didn't work out.
Right, that's what they say. They also said, as far as euthanizing dogs after 6 months, they said this was the part taken out of context. They have obviously discussed what can be done because they have too many dogs and they can't adopt enough out, apparently.
Right.
This is not a new problem. However, they have made no decision about euthanizing dogs in any way, shape, or form at this point.
Okay.
And there is nothing about a certain term of when euthanasia would take place. They say this is not a current practice and no decision has been made by the board. Maybe it's been discussed as an option, but nothing has been decided. Also, as far as volunteers, they welcome volunteers and they are valued, but they must follow proper procedures and scheduling to ensure the safety of both the animals and the public. I assume, based on the original Facebook post, this has to do with the fact that they are expecting a waiver to be signed. And if you can't or won't do that, then for liability reasons, they're concerned about you volunteering at the pound, even though volunteers are badly needed.
Gotcha.
So, you have some this and that doesn't completely line up. But what we're going to try to do is give you what the complaint was and how the commissioners responded to it. And that's what I just tried to do here on Main Street TV.
Two sides to every story, right?
Right, absolutely. Okay, there is going to be a Meet the Candidates night that the WTA is going to do. That is always a good thing when you have a lot of school board candidates. There's 7 candidates running for 3 school board seats in the Wellston City School District. And it's kind of a live wire thing. Nobody is maybe saying this publicly, but a lot of it has to do with the superintendent, Dr. Rao, not Dr. Brian Rao, leaving. His contract was not renewed. That's not really the thing to say. He resigned because he felt his contract would not be renewed. And so that's kind of polarized the district a little bit on the pros and the cons there. So the WTA, and this is not something that they've done every year, at least every election year, they're going to hold a Meet the Candidates night. It's going to be on Monday, October the 6th. That's next Monday from 7 p.m. to 8 p.m. at the Wellston High School cafeteria. The public is welcome to attend. The school board candidates will be seated on the stage, and the public will have a chance to ask questions.
This is a great thing.
Right, exactly. So we'll be covering that, of course. It is a great opportunity to see the candidates up front, not base your vote on a sign or a comb or a handshake.
Yep.
So
Love that.
Right, exactly. So we hope that all the candidates will participate in that. I know that's a big step up for some people to be put in that situation.
It is, but also more importantly, that the public participates.
Right. Well, this is an opportunity. You know, everybody seems to be. Many people seem to be concerned, and that's good. But this has taken an extra step to be involved. And you know, if they're going to get up on the stage and put themselves on the line, you should at least go and hear what they have to say. And for those who don't, you know, hopefully we can fill that void just a little bit with our reporting.
Sure.
Okay, a couple of other things to tell you really quickly. Let's go to a sports item. The Jackson boys golf team on Monday evening they were in the district tournament and they played well enough. There they are.
Hey, they have cool hats.
They do. They do. Well, it's sunny outside. You need to predict that noggin. They advanced to the next level of the tournament. They qualified with a fourth place finish. The top 5 teams get to go to the next level of the tournament. And at this tournament, this district tournament that was held at Williamsport, they finished 4th. The top 5 get to go. I'm not sure how many teams were there, but the top 5 get to go. And the top scorer for Jackson, he was the overall, about all the golfers there, he was in 6th place, is Colt Cross. He shot an 81, and the most impressive thing about that is he's just a freshman.
Oh, cool.
So, you know, congratulations to him. The other golfers for Jackson were Parker Holstein, Dalton Kite, Garrison Markham, and Tristan Tipton. And so, you know, that team will go. Now go to the. That was the sectional tournament. They will go to the district tournament. These levels for sports are sometimes different, but it was the sectional. That's the first tournament. That's Division I. That is the biggest schools in the area.
Wow. Okay.
And so that's a little tougher for Jackson.
Sure.
Because, you know, the bigger an area is, the more golf courses they are, and there's more participation, et cetera. But Jackson had a great season. They won the FAC, the Frontier Athletic Conference, and now they've gone up a rung of the ladder in the tournament. That next tournament will be at Lancaster, and that will be next Monday, October the 6th. So congratulations to the golf team. Congratulations to Coach Kevin Bowman and Assistant Coach Dr. Rick Billman.
There you go.
All right.
Congrats. That's
Absolutely.
exciting.
Yes, it is.
Such good kids in our area.
Yeah, well, the golf program at Jackson went very well. Both teams won conference championships, and now they're doing well in the tournament as well.
It's amazing. Absolutely.
Right, and you know, all that will be in our sports section.
See?
Todd Compston is usually up, our sports editor is usually up almost all night, the night before a paper, trying to gather all that up, writing, editing, and then designing the page so, you know, it's ready for me to look at when I come in on Tuesday and Friday mornings.
There you go.
All right.
Well, Pete, thank you so much for hanging with us this morning. Thank you to Health Commissioner Kevin Aston for spending his morning with us and filling us in on the fancy word.
All right, and you know, Kevin talked about total media, and I know he has availed himself and his staff of the opportunity to come here on TV and be on the radio as well. They work very well with the Telegram, the newspaper as well.
You got it.
They put out news releases. They call us our media partners. We really enjoy that because it's good for the health department, but it's good for us too. We want to get as much in the paper as we can. That is important for our readers out there.
It is, absolutely.
Right. So if they care about us, we certainly care about them as well.
Yep. All right. Well, I'll tell you what, we have to get out of here for the day. Another beautiful day in downtown Jackson. And so we will be right back here in the morning. So have a great day, and we'll see you then. Bye-bye, everyone.